Hi, nurses. Welcome to Shift Change, the podcast for nurses who are ready to shift their thinking away from the just a nurse mentality and into claiming their position as powerful agents for change. I'm your host, Amy Deagle, Chief Nursing Officer and President of the International Network of Nurse Leaders. Our mission at the International Network of Nurse Leaders is to amplify the voice of nurses, inspire the new generation of nurse leaders, and lead a change revolution in the nursing profession. Everything we do is because we believe in the power of nurses to change the world. So let's get started. Hi nurses, welcome back to another episode of the Shift Change podcast. I'm so excited to be bringing you this week's guest and also celebrating Nurses Week this week. May 12th is Florence Nightingale's 200th birthday. 2020 was designated as Year of the Nurse and the Midwife, and this week in May we celebrate nurses all over the globe and the contributions that they make, not only in this crazy pandemic time, but also every day in normal circumstances. And we have a really great guest on today, Howard Catton, who is the CEO of the International Council of Nurses. And Howard has been such a voice for nurses through this global pandemic, advocating for PPE, safe work environments, and also advocating that nurses are recognized for their contributions and to, really look at opening up scopes and lobbying governments to have nursing voices in official government capacity. So Howard was appointed as the Chief Executive Officer of the International Council of Nurses in February of 2019. Under his leadership, ICN is seeking to maximize the opportunities presented by the 2020 International Year of the Nurse and the Midwife and build on its legacy. He is committed to ensuring that nurses have a seat at the highest level of decision-making for the benefit of the profession and global healthcare. Howard joined ICN in April 2016 as the Director of Nursing Policy and Programs. His team led the development of ICN policy and position statements, working closely with the World Health Organization and other international organizations to provide nursing advice on global health challenges and input into formal World Health Organization and UN decision-making meetings and processes. He's also coordinated ICN programs and projects, including leadership development, and worked closely with other non-government health organizations, civil society, and private sector organizations. Howard also oversaw the development of scientific programs for ICN events, including its World Congress held every 2 years. In December 2019, the Royal College of Surgeons in Ireland appointed Howard as a Fellow of the Faculty of Nursing and Midwifery. This fellowship, without examination, is granted in exceptional circumstances to nurses who have rendered outstanding service in the profession. So Howard qualified as a registered nurse in 1988 and held a variety of nursing posts in England and the United States and worked for the New Zealand Nurses Organization. He studied social policy at Cardiff University and industrial relations at Warwick University, and then worked as a personnel and organizational change manager in the National Health Service in the UK. For 10 years, Howard was head of policy and international affairs at the Royal College of Nursing in the UK. His department worked with a wide range of stakeholders on the development and implementation of nursing and health policy in both UK and overseas. He worked closely with a variety of government departments and Westminster parliamentarians on many policy and legislative issues. He has also led and supported many national campaigns and was frequently the RCN spokesperson in a range of media. In 2015, he was named in the Health Service Journal Top 100 Clinical Leaders list. Howard has also served as an elected local government councillor in England and for 5 years was a cabinet member with lead responsibility for corporate and customer services. During this time, he also worked on several public health, community development, safety, and well-being initiatives. It is my great honor to introduce Howard Catton to the Shift Change podcast. So Howard, welcome to the Shift Change podcast. I cannot thank you enough for being here with us today. It is such an honor to be speaking with you. Howard, can you tell us about your journey from, where you started in nursing to International Council of Nursing CEO?
Well, look, firstly, great pleasure to be speaking with you. And whenever anybody asks me about the journey and the plan, I have to be very, very clear. Say I never had a plan, and when I look back, I sometimes wonder how things worked out in the way in which they did. But for me, there's actually a really important point in all of that I've always stuck with doing jobs or in roles which I've felt really committed to, excited about, passionate about, where there's been a bit of fire in my belly. And there's been moments in time where people have said, oh, it would be good for your career if you got some experience here, or you went there, or you thought about doing this. And if I haven't felt a real energy and drive to do those things, then I haven't. But I think that's important in terms of how things have progressed and developed. That if you feel committed, if there is that fire in your belly, if you take the opportunity, it invariably leads to opportunities and opens doors and new relationships that you could have spent hours planning ahead and thinking what you're going to do, and you would have never been able to achieve that. I started obviously as a registered nurse many years ago now, but very early on in my nursing career, I found myself frustrated with some of the challenges that nurses still have today in terms of voice not being heard, lack of resources, the pressures of work, and also seeing where health systems were failing or weren't doing as well as they could because they hadn't taken a real input from nurses, from people on the ground who were delivering services, and that ended up with me trying and finding myself in all sorts of nursing related roles. But there was often a theme that ran through them, as there was sort of like an advocacy piece that went with them, and I spent some time in management roles, in clinical roles. I spent some time out of nursing in local government. I spent some time as an elected politician, which was invaluable in terms of knowing and understanding what matters to people, and also thinking about always being aware of how people could hold you to account through the ballot box and the pressures and demands that brings. And then I had some fabulous years working in different roles with the Royal College of Nursing in the UK as well. And it was my last role with them, was in charge of a lot of the policy and international work for the RCN, and from there it brought me to Geneva and ICN.
And it's been quite an exciting past few months. We know nurses across the globe are consumed not only in the frontline battle, but also some of those behind the scene positions like nurse researchers, policy advisors, all those type of roles that nurses play as well, all working in the fight against COVID. What message do you have for nurses right now facing one of the biggest challenges of their careers and lives?
Well, actually, my first message to nurses is look after yourself and look after each other. I've been talking to nurses around the world from the start of the outbreak. We've got associations in China, in Taiwan, in Singapore, in South Korea. We've followed the virus around the world, obviously with the associations, particularly in Spain and Italy. We're talking last week with associations in Africa as well, where the numbers of the numbers of infected people in Africa are at the level that they were at the start of the outbreak in both Asia and in Europe. And there is no doubt that nurses in those countries are working under intense pressure, long hours, back-to-back shifts, some people sleeping overnight. They're dealing not only with the physical demands of caring for people with coronavirus, but some really significant mental health issues as well, in terms of not just obviously patients who are fearful and anxious and nervous about how the virus may develop, some who are feel guilty that they might have passed it on to others, but then of course the nurses themselves who are dealing with being separated from their families who are worried about them if they're at higher risk, not being perhaps able to hug their kids in the way that we've seen before. So that the intensity of the pressure on nursing staff is huge, and that's why nurses do need to look after themselves and look after each other. But what this is doing is that we have planned this year to be the year of the nurse and the midwife. It is the first ever designated WHO year of the nurse and the midwife, and the reason for that was to put nursing in the spotlight, to show the world the reality of modern day nursing, the value that nursing brings, the need to support and invest more in nursing in terms of addressing the global health challenges that we have now and in the future, for busting some of the traditional myths around nursing as well. And whilst that was all of the things that we planned, what COVID, I think, is doing in a way which is even more powerful than could ever have been imagined by designating a year as a year of the nurse and the midwife. What nurses are doing every day in their practice is demonstrating all of those things. That it's not just care and compassion; it's courage and bravery. It's all of the interpersonal, the relationship, the physical and the mental health competence, but it's also much more sophisticated specialist clinical skills for acutely ill people. It's about having nursing intimately involved in the planning of at a national level, the response and preparedness plans at a national level as well. Our associations who are sitting alongside government advisors and politicians to prepare those responses. So it's something that none of us wanted. We didn't plan for it, and there are moments where I feel awkward talking about it in this way, because I don't want to in any way suggest that this is that we're somehow using an opportunity to talk up the press, but it's the reality. The world is seeing the reality of what nursing is all about, and making the most powerful of cases as to why we need to do much, much more to support and invest in the profession. And the tragedy of what we're going through now will be if we don't learn those lessons of preparedness, of how we strengthen health systems, of the need to invest in nurses and midwives, and make a step change in how the world and health systems view and regard nurses and the nursing profession. And nurses should also just feel immensely proud of what they are doing at the moment. They are saving lives and changing people's lives in a way that I struggle to think of anything that could be a more important purpose for any job that somebody does.
Yeah, I agree. And back in October, we actually held, the International Network of Nurse Leaders held Not Just a Nurse Day. And it was really about dropping that, how we describe ourselves as just a nurse. And after, this response that nursing has had in the COVID crisis and demonstrating our immense value and our leadership and our courage and our bravery, I really hope that this is the end of ever saying we are just a nurse, and we really claim how important we are, not only to patients and our health systems, but also our communities and, the health of the population of the globe. So, we've seen in a relatively short period of time incredible advancements in regulators and governments removing restrictions to practice. There's been granting of full scopes of practice from nurse practitioners to RNs and LPNs, increasing autonomy in roles that were previously micromanaged, for lack of a better word. How do we ensure that once this crisis is over, that we keep advancing our profession forward and don't backslide or return to the way things were?
So we've just published the State of the World's Nursing report, first ever WHO report on State of the World's Nursing. That's quite an incredible thing to say in itself, isn't it? In terms of where we find ourselves as a profession that we have never had, a global. Anyway, we have now. We've addressed that, and ICM partnered with WHO, and we had Nursing Now who supported the production of that. Look, there's lots and lots within the State of the World's Nursing Report, and we can pick up some of those issues. But specifically on the advanced nurse practice point, the report, State of the World's Nursing, says that only about 50% of countries have advanced nurse practice roles, and I think that's a massive missed opportunity for many countries. That they have not supported the extension of practice, allowing people to work at full scope. What the report does is it sets out the evidence base that we know exists in support of advanced nurse practice roles, in terms of the great patient outcomes, as good as or as better as other colleagues, other health profession colleagues, high levels of patient satisfaction with nurses who are working in advanced roles, more accessible services, the potential for future models for NCDs, for non-communicable diseases, to be the predominant model, to be a nurse-led model. And it also sets out that, as well as being care effective, nurse roles, nurse extended roles, advanced roles are cost effective as well. And sometimes we've been a little bit shy about talking about the money. We get caught up in the discussions about, but we're not a cheaper alternative. Of course we're not. We're not a substitute for doctors. No, of course we're not mini doctors. We're maxi nurses. But there is an absolute cost effectiveness argument to be made, and there are, the dynamics of the medical workforce is going to suffer even more with aging as well. So now the fact that all of this is in a WHO report, if ICN were to write that report, others have already written about this before, as we know, but the fact that it's in a WHO report, WHO has to hold to a very high bar the way in which they write and describe any of their reports in terms of it being evidence-based. WHO are saying, on the basis of the evidence, these roles are hugely important to design and delivery of services in the future, and it included within the recommendations, the strategic directions from the report. We tried to make the executive summary as neat and as accessible as we could, with just 10 straightforward recommendations. Rolling out and maximising the potential of advanced practice is in there. So take all of the evidence and don't shy away from the evidence in relation to the cost issues as well. Take that and use that to build on where advanced practice exists already. ICN has also got a fabulous advanced nurse network, and before this, I very much hope, before this, our conversation is broadcast, we will also have some new ICN guidance out on advanced nurse practice competencies as well. So watch out for that.
Great. So if somebody listening to this episode, Howard, wants to be part of those conversations that are going to be happening in healthcare systems and with governments across the world, because we do know that the COVID crisis has a huge economic impact as well. And governments and health systems are going to be looking at more cost-effective measures and ways of delivering care. So if somebody's interested in having those conversations, how do we... what would be your advice for them on how to get into those roles, or how to start having those conversations, how to get involved in kind of that higher level discussion?
Look, I think it's I think it's incremental as well. So if when I look back and think, well, how did things start for me? Things started for me where I saw issues and problems within the clinical areas that I was working with, and was involved in the canteen conversations with colleagues about, well, we could do better if we did it like X, Y, or Z, and I thought, well, what do we do about this? And to talk to your senior manager, to work through the organisation that you work within, to know who your chief nurse is, but also to know who the leaders from the other professions are as well. So there is something about bite-sized chunk size pieces to all of this, and just approaching things in a sort of a fairly logical way. And also think about, this was somebody gave was a tip that was helpful to me, was to think about, whoever I'm talking to and describing this issue to, how could I describe it to them in a way which would make their job easier, and which would be a solution to them as well. As I got a little bit older, somebody also said, and if you can work out or know what the objectives or what the objectives are that your manager has been set as well, that's another little trick to be aware of in terms of what their focus and their priorities are, and then how you can start to think about how you align what you want to do with them. So there are, some of that is fairly, I know it sounds simple, but it's I think it's important. It's the building blocks. It was really important to me to be involved with my association, and that whether that's a local group, a regional group, ultimately as a national group as well. It's a huge source of support and advice. And the other thing that the associations do is that they then provide a way in which you can take that experience through political communications channels as well, because they have well established methods of communicating and lobbying and briefing MPs, politicians, parliamentarians, policymakers as well. So the associations are I think are really effective and important to think about in all of this as well. But the way that healthcare is going, it's always been like this, but it just strikes me it's even stronger now that you just need to be pragmatic and flexible about, for different issues and different problems, you probably need to come together with different people and different groups. One network, one set of close colleagues may well work for a particular issue, but once you move beyond the confines of, say you're working in a hospital to the community, actually to get stuff done in community roles, you'll be thinking about, I need where's the local housing department, education department, who are the local government social services people, what about voluntary and charitable organisations? So be flexible and pragmatic around joining together with different partners, different groups, different organisations at different times. And then when you do that, you suddenly find that you just, a few months or a few years down the line, you end up with, put it as crudely as you got your finger in lots of different pies. But that network is just invaluable to you to get stuff done. It was one of the toughest things when I moved from the UK to Geneva. Thinking, well, I know a little bit about how international health works, but I was put into it where suddenly all of the network that I'd built up in the UK, of course it was there, but it was the UK, and the network globally and within WHO, and I went back to basics in terms of building my network. The sort of approach that I used to do that was very, very similar to what I did in the early days of my career. And when I say that wasn't that I realized I was doing it and had some grand plan. It was just, pragmatically and instinctively, if I want to get this changed and got to get this done. So who's in charge of this? Who do they talk to? Who do they relate to? Who are the people with the money, the decision makers, the policy levers that would need to be affected or changed?
Great. Thank you. So we're going to make sure that the State of the World's nursing report is linked in the show notes of this episode as well, so that people can take a look if they haven't seen it yet. Hey nurses, I'm sure all of us are finding these times more stressful than ever. It affects our mental health, our sleep, our joy, and our resilience. I know lots of us were heading on a burnout track long before COVID ever showed up, and it has done nothing but make that worse. And I don't want you to burn out, and neither does Victoria from Stressless Ladies. Stressless Ladies has developed a 6-week online program to support women to manage their stress and build resilience through COVID-19. And she is making it free of charge to frontline workers. So each week, the content is no more than 30 minutes, and there is bonus material if you'd like to dive deeper. The course talks about how you can re-envision 2020, build habits that support you, create joy even in the most trying of times, overcome self-sabotage, and more. If you'd like to access the course for free, you can go to stresslessladies.com/frontline, and you'll receive access within 48 hours. That's stresslessladies.com/frontline. Now let's get back to the interview. So what do you envision for the future of the nursing profession globally?
So much. Because I can't. If you look at the health challenges that the world is facing, non-communicable diseases, infectious disease, and obviously COVID right in the middle of everybody's epicenter at the moment as well. Migration, a movement of populations and people, the health impacts of climate change, and aging population. When you start to just describe what the global health agenda looks like, I often say, and I don't mean to be trite about it, but I see nursing work. I see that it's to address all of those issues, just how fundamental and central nurses are to that. So that and Tedros has said quite plainly that he can't. He won't be able to achieve his vision of global health, and his vision of global health is, a lot of people have a not dissimilar, vision as well. It's not going to happen without the nursing and midwifery workforce. 59% of the nursing and midwifery workforce. So I think there is absolutely something about just how we clearly articulate that global health agenda is a huge amount of it is nursing work. But then we need to get nursing. We need to make sure that nursing's in a position where it can deliver on all of that. And we know this isn't to take away from the fact that we've been, for the last 3 years on International Nurses Day, the publications that we as ICN have put out to celebrate International Nurses Day have very, very deliberately had case studies of nursing practice from around the world right at their heart, showing and demonstrating what nurses are doing now in different roles, in innovative roles across a whole range of settings, how effective they are to outcomes, to improved access to healthcare as well. But what the State of the World's Nursing report does as well is to shine a very keen light on where some of the weaknesses and deficiencies are in terms of maximizing that nursing potential. A 6 million shortage of nurses around the world. That's over 20% of the current workforce. And I say to people in other sectors, can you imagine going to work every day being 20% plus down in terms of the people and the resources that you need to do whatever your work is? And if you are that consistently down, I know we're talking about an average here, and in some places it will be much higher than that as well, but for the sake of the report, it's 6 million. What impact does that have on you over over the weeks and months as well, in terms of the stress, the pressure, the burnout as well? So we need to, and then you say, well, how did we find ourselves in this position where we're 6 million short? There's a statistic in the report. I've mentioned the 59% statistic. The other statistic you'll find in the report is that, again, it's an average, but globally, we only spend about 25% of the health education budget globally on nurses and midwives. We only spend 25% of the budget on 59% of the workforce. Now, look, that cannot be right. And I'm not saying that we should necessarily get 59%. Perhaps we should, but it cannot. cannot be right that it's 25. You then look at some of the other findings in the report. And I won't go through all of them. It's like I encourage them to go and to look. But you see this history. You see a history of under-resourcing and inequity as well, and of poor working conditions. There is something in the report about how many places have measures in place to protect nurses' safety, and it was the figure actually was 37% said that they do. But when you dig into that, actually, it's only from 55 countries who have responded. So it could be as low as 20%. So we are across both recruitment and just having not invested enough in growing the workforce, and that being a big message. There is an equally powerful and important message around retain. And when you then dig into what we need to do to retain, I think there's so much of that which actually takes us to issues which are intimately connected with the fact that we're overwhelmingly female-dominated profession, and some of the inequalities and discrimination that we see are a result of that as well. The good thing is that again, if this is a WHO report which is exposing this, so to take this as like it's not just what the Canadian Nurses Association or the ICN say should be done. This is a WHO evidence-based report, and to take that now and to take it in the context of what we're going through and what we will come out of, hopefully in the not too distant future as well, I think gives us. And again, I'm careful about how I say this, but the environment that we can take the evidence and the value of nursing into is, politicians and policymakers have got to be. This is probably the time that they could be most sensitive to hearing, reacting, and making some positive change on the back of this. It is a more difficult time. I believe it will be a more difficult time for politicians and policymakers to say, we think you do a great job, but we can't fund that, or we can't support that, or we can't go for that at this moment in time. I think that we need to take this time in the next few months to push them really hard and to hold some feet to the fire as well, and to get some harder actions and commitments, and platitudes, applause, clapping, a place, but we want some commitments and actions from our leaders.
Absolutely. And I'm glad you touched on the gender disparity, because I think that's true no matter what area of the world that you're working in with nursing. We've done a disservice to ourselves because we just keep doing more with less, and we don't really use our voice to stand up and say, hey, you know what, we need to be recognized for the work we're doing. We need more money put into education dollars, like that sort of piece. And so do you think there will ever be a day that we see a global benchmark for the education standard and title use, nurse, registered nurse, whatever that is?
Yeah. I think that's always it's always difficult because of just this is the other. It's been the other huge and massive learning for me over the last 3 years is that the country contexts are so very different. A lot of my prejudice and preconceived ideas as an English guy with all of the tradition that brings around Florence and nursing and everything else, some of that has been kicked into touch very, very firmly when you've seen in other countries less resource, less infrastructure, but who have put in place some phenomenal nursing solutions which are absolutely appropriate to their context. So the standardization point, I think, is there is always that health warning around that. But I think that there is the greater transparency piece and shining a light on and using some data and metrics in terms of some of the data, what benchmarks do exist, where there is data, what is or isn't being what is or isn't being monitored. I mean, an example of that for me, just in relation to migration and mobility of nurses around the world, which we know is, it's a phenomenon we've had for a long time. Nobody, of course, is going to stand in the way of individuals moving. Nurses and health systems can get a lot of learning out of all of that. But the reports say the world's nursing highlights how significant that is, and also flags the impact that can have on countries who already have a weaker health system and a smaller number of nurses. You look around the world and we have the range of the numbers of nurses per 10,000 population ranges from less than 10 to more than 100. So if you imagine if you're in a country where you have less than 10 nurses per 10,000 people, but then a country which already has more than 100 nurses per 10,000 people comes and recruits, because that country has a shortage because they haven't invested enough. But the impact on the country who's losing that nurse, it can be as stark as the fact that they have to close down services. And I think again, I use it as an example of where let's shine a little bit more light on numbers and flows and patterns and share that, so that it's easy for people to talk a good game and give us the warm words about we're committed to growing our workforce, and we would, if we recruit from another country, we would do that ethically. But there is some data in this report where you can say, well, look, there are European and in Europe and in the Americas, they have aging populations, and 20-25% of their nurses could be retiring in the next 10 years. What we currently know, are they training enough nurses to replace those nurses who are going to retire? No, many of them are not. And if they're not, where are they going to get their nurses from? And historically, they've recruited from overseas. So use the evidence and use the data, but interrogate and analyze, and don't be fearful of putting out some of those questions. And
Great, thank you. So just in closing, Howard, I know we're at our time limit. Is there any last words, pieces of advice you want to share with nurses, just as we kind of face this new chapter and what moves into the post-COVID, nursing world? Hopefully sooner than later. Yeah.
So I listen. The profession should be hugely proud of what they're doing and what they're achieving at the moment, and the differences that they're making to people's lives on an individual basis, on a family basis, on a community basis as well. But this is also a time to don't be shy of taking the adulation, but be really confident about what you're doing and what you know and your abilities. I've over the last months, I've been talking to a lot more nurses who've been at the front line of dealing with coronavirus, and some of them we've then involved in, like our webinars. One of them actually was in conversation with Dr. Tedros and Elizabeth just last week, and that nurse, when she first contacted me and I talked to her, she was enormously eloquent and articulate, and then when we went back and I said, look, there's this opportunity to do something with WHO. She was just, understandably, she was a bit nervous and a bit anxious and about, do I really know enough? And of course we supported her to do it, and she was just brilliant because she was the expert in the room. She was absolutely the expert in the room. And what I think that probably she and others didn't realize as well was that the way that they were then describing what was happening in their health system, she was using, good old traditional Virginia Henderson nursing process in terms of assessing the problem, analysing what needed to be done, putting a plan together, implementing it, reevaluating. And she was doing that, and that's what she was describing in terms of how she and her health system were responding. And within the richness of her practice was gold in terms of what countries' policy responses should should be. And we need to, I've sort of described before, this sort of golden thread between nursing practice and policy. And I can't see how you can make good policy. And I see where I think there's been examples of bad policy because it has been people who have not been informed by the reality of what's happening at the front line. So building and growing that confidence, and then what we as ICN can do to try and to bring nurses into policy making dialogue with WHO, to arm them with the evidence, to support them through associations and through networks, to do some leadership development as well. That's where ICN is it's a hugely important historical organisation, but actually its strength is its members. We have a very small staff team, but we have 130 national nursing associations. So that's where a lot of our our power and our potential comes from, and then to make those media and political connections as well, and to make sure to give voice to what's happening and to what's going on as well. But I've one of the issues that I've been worrying about, still I'm worrying about with the whole COVID situation, is that could the outcome, the glass half empty, more nightmarish scenario for me is that whether what we're having to do at the moment to advocate for nurses to get personal protective equipment, the dangers and the risks that nurses are taking, whether that could actually put some people off joining the profession in the future. And I'm worried about that. I'm worried about those. Just today, we've written to the G20 leaders telling them that they need to step up and do more in terms of personal protective equipment. We're taking it to the highest. We've talked to WHO before, but we're not mucking about today. We've said this is going directly to G20 leaders, and we'll see where we get to on that. But the plus side of this is that if we are able to follow through, to take this moment, this opportunity to I've said the recommendations, the policy directions for state of the world's nursing, they're not optional, they're not nice to do. They now absolutely became a must do, and we should present them as that to our politicians and policymakers. And if we do that, and if we get the commitment and the recognition there is of the profession, actually the glass not just half full, but potentially overflowing, could mean that the profession attracts people to it in ways never before, where you see you see a job, and it's more than a job, but you see a role and work where you can make changes to people's lives in a way that very, very few others can, combined with the recognition, the value, and the practical support around decent conditions and pay as well. So that's the world that I'm aiming for.
Well, I think we have a unique opportunity right now. I think there's never been more attention on nurses, demonstrating just how vital and important we are, and the sacrifices and courage and bravery that it really does take to be a nurse, especially in this time. So I think if we continue to get behind our, nursing associations and the ICN, we will start making some of those changes, because I think there's a lot of nurses, especially the younger generation of nurses coming in, that are very innovative and creative and see a different way of doing it. And I think we have a unique opportunity to bend the ear of government and healthcare organizations and present some of these opportunities. So thank you for all the work you are doing, and for the fight for getting nurses the proper PPE, and just the awareness that that you're bringing that situation. We truly appreciate all the work you've been doing.
Amy, it was I couldn't agree with you more, and it's been a privilege as well to talk to you, and thank you for also the opportunity to talk about the work that ICN and our associations are doing. It's very much appreciated.
Well, thank you very much. I appreciate your time. Thank you so much for joining us today. If you loved the advice shared on this episode, we would be so grateful if you would let us know. please head over to Apple Podcasts, formerly known as iTunes, and subscribe to our show and then rate us and leave your review. We would be so grateful if you would take the time to subscribe, rate, and review. While you're on our website, nurseleaders.ca/connect, all of our social media handles are there, and we would love to get to know you on social media as well. Thank you again for listening today, and remember, nurses, we have the power to change the world. Let's start today.